Alrighty. Welcome everyone. Good afternoon. Thank you for joining us for our monthly All In for Kansas Kids, Strengthening Early Childhood in Kansas Systems Building webinar for November 13th, 2024. My name is Julia Gruss. I am a research project coordinator at KU's Center for Public Partnerships and Research, and I will be your webinar facilitator for today. Bree, you can go to the next slide. I am joined by my colleague, Bree Houston, who will be running the slides for us today after our technical issues earlier, and I will be dropping any of the relevant links into the chat as we are going through the presentation. Reminder, our webinars are always on the second Wednesday of the month. And please sign up to receive the All In for Kansas Kids e-newsletter. You can do so by going to www.kschildrenscabinet.org. Today, we have two presentations for you. One on the new CAPE portal by Hynek of KCCTO, our Kansas Child Care Training Opportunities. And Melissa Schoenberger will be joining us from the Kansas Department of Health and Environment to discuss some new childcare systems improvement team initiatives that are happening throughout the state. So without further ado, I'm going to pass it over to Haley to get started on the CAPE portal. Bree, next slide. Thank you so much for being here, Haley. Go right ahead.
Thank you, Julia. Thank you, Bree. Very excited to be here with all of you today to share information with you about CAPE, the Career and Professional Empowerment Portal for the Kansas Early Childhood Workforce. Like Julia mentioned, my name is Haley Hynek. I am the Associate Director of Workforce Systems at KCCTO and the CAPE Director. I'm also joined by Emily Bertels-Kaufman from KU Center for Public Partnerships and Research. I had to look at that because I always get it wrong. KUCPPBR, lots of P's in there. She is the project manager for the CAPE technical build and has been really integral in this process to bring CAPE to you all very soon. So Bree, if you move to the next slide, we can kind of get into a little bit of an overview of CAPE. So let's start with the journey that brought us here today. So CAPE is our state's response to a long-standing need in the early childhood ecosystem. It's the need to streamline and improve access to resources for early childhood professionals. We've been hearing about that for a very long time. CAPE it's part of a broader system of workforce investments and needs, and really part of this All In for Kansas plan too. It includes things like core competencies, career pathway, and your CAPE.org, the landing page for CAPE when it's officially live. CAPE represents several workforce investments by the state, and those are again listed here. The core competencies, the career pathway, they're all coming together in this system. On the next slide, Bree. So just to kind of shout out to all of the collaborations that have helped make CAPE possible. KCCTO, Kansas Child Care Training Opportunities, is the lead in CAPE's development in collaboration with numerous state agencies and state level organizations that all collectively will manage the portal. So the Kansas Children's Cabinet and Trust Fund, Kansas Department for Children and Families, Kansas Department of Health and Environment, Kansas State Department of Education, Child Care Aware of Kansas have all been at the table helping to bring CAPE to life. Next slide, thank you. So we really want to move in next to what is the reason behind building this portal. We want you all to feel empowered and connected, and we also want to address some of the challenges that we know the workforce has faced over the years. So we've heard about things like navigating multiple systems being difficult. There are a lot of systems out there. Facing barriers to information, really struggling to get the information that you need to do your job and serve children and families. And then also with all of that, feeling undervalued and probably burnout, especially over the last few years and all of the things that have been going on in the world coming out of COVID and all of that as well. So we really hope to address a lot of these challenges by providing a single online portal, a place where we can streamline processes, open up greater access to the information that you need to do your job well, and make it easy for you to identify what your professional development options are and what you want to take action on for your career. So we really want to make this easy for you to access the tools that you need to manage your own learning and your career growth through things like empowering the workforce. So we want to empower you to manage your own professional development, your own growth. We want to support professionals as they progress along their career pathway and provide the information that they need to know what is the career pathway and where am I on the career pathway. Again, aligning and streamlining all of these processes across all of these systems and organizations so that we're reducing the burden for you to figure out where to go and what to do. We're reducing duplication of effort from the support system, and we're reducing the reliance on paper forms that take forever to get through. So hopefully making things a lot faster and easier to navigate within CAPE, while at the same time prioritizing your privacy and the security of your access in CAPE in the portal. Well, also with all of the access, all of the information that we'll now be able to see and do in CAPE, we'll be able to gather insights from aggregate data about CAPE use. And then we'll be able to operationalize those insights so that we can improve training offerings, inform policy, and guide investments for the early childhood workforce so that we can continue to build on this really exciting platform and strengthen the early childhood workforce in Kansas. So initially, we're focusing in CAPE on Kansas early childhood professionals who provide direct care in all settings, licensed and license exempt, as well as the individuals who support direct service professionals by providing training, technical assistance, coaching, mentoring, all of those support services. The portal, it's really designed so that we're meeting your individual needs as a professional, making it a really user-centered experience for you. It's really all about you as a professional. And then in future phases, we're expecting to expand the portal to more a broader view of the workforce. So including things like family support professionals, like home visitors, early intervention, along with more systems level partners. So really expanding who's accessing CAPE and all of the support then that you all as individual professionals can access will expand as well. Okay, so what can you do in CAPE? I will give you a quick little sneak peek. I'm not sure that we can maybe try the video, but it might not work. Bree, I don't hear any sound, so we may not be able to hear it. Is anybody else hearing sound? Nope. Okay. If we're able to link the video in chat, that it's a short video, just a little overview of CAPE, but it's pretty exciting. So I'd love for you all to watch that if we can get that. Thank you, Emily. It's there in chat. But we'll just move forward then with really a sneak peek. I have a series of screenshots to just kind of give you all an idea of what it is that we're talking about. It's hard sometimes to envision things when we just talk and talk and talk about it, but we'll start here with some screenshots. So Bree, if you go back one slide, I just wanted to provide a sneak peek of the homepage of CAPE. So this is what you'll see when you first come to yourcape.org. Once the site is live, there will be more information down below, of course, but basic access to career tools, professional development, which includes how you register and find training events, learning tracks, things like that, and then a help center. And then, of course, in the top right-hand corner, you can log in to your profile or create your profile. So if you were to click on the professional development dropdown, that would give you access to courses and training. So Bree, on the next slide, we'll see a screenshot there of the course catalog, if you will, of available courses. So we have a list of filters on the left-hand side. You'll be able to filter courses by things that matter to you, whether you're looking for courses, training, events, or learning tracks, things like the CDA training track that KCCTO offers. You can filter by those categories: CDA settings, CDA subject area. The new core competencies will be reflected on courses. You can also choose what language the course is delivered in, what delivery type. So if you're looking for an online course, in person, a live virtual, or potentially a hybrid of some of those offering delivery types. And then the health and safety requirements, where the training is being held, if it is an in-person training, and then the settings that make sense for you, or the roles that make sense for you. Are you an infant care professional? Are you a preschool care professional? Things like that. You can also sort by title, clock hours, price, start date, so you can find things that really meet your needs according to those items there. So let's take, for example, if we had selected that very first course on the list. And I do just also want to take a step back real quick. You'll notice it says test approving agency. We're looking at test data here. This is not live data. So some of the information here will be missing or have fake names. Just a little bit of background there. But on the next slide, we'll have, if we had selected view course offerings for that very first course on the list. Bree, if you go to the next slide, please. This is what go back one more. This is what looking at a course with any offerings would look like. So you'll have the description of the course, you'll have more details about what that course includes, what exactly are the core competencies, the CDA settings. All of that will be listed on the right, or on the left. On the right, you'll see any offerings. So this course only has one offering, but if there were multiple, you would see multiple listed in a vertical line there on the right. But it includes the start date, end date, and time for those offerings. If there's a registration deadline, how many seats are available, what delivery type and language that particular offering is offered in, and then you have the option to add to cart. So on this page, we'll see if you had logged in and you had created a profile, you'll see what your profile will look like. This is just, again, a small piece of the information. There's much more information that we will collect, but you have the ability to provide your name, if you want to indicate pronouns, your birth date, contact information as well. Previous last name, that helps a lot to help keep track of the courses and training that you're taking as you potentially change names over the years. We also have the ability for you to indicate what your native language is, if you speak additional languages, if you prefer to learn, if you prefer to take courses in a certain language, and then also, so say I live in a certain location and I don't want to travel to in-person courses across the state, but I can choose which counties I prefer to take training in. So just for a little bit of context here. So on this test profile, I selected that while I speak Spanish and I also am proficient in American Sign Language, I prefer to learn in English. I prefer to take courses in English. So Bree, if you go back one slide, I'll call out here on this course offering. This offering that I selected and added to my cart is the delivery language here is listed as Spanish. So now, Bree, if you go 2 slides ahead, you'll see that there's a warning message that shows up. If you indicate on your profile that you speak a certain language, but you prefer to learn in a certain language, and you choose an offering that does not match with your learning language, a warning message will pop up and say, this is just not, it doesn't match with what you've indicated on your profile. but you have the option to proceed anyway if you choose to do so. But it's just a heads up for you there to kind of indicate, hey, just make sure you understand what you're signing up for. The same type of message can also pop up if I had selected an in-person training that was in Riley County, but Bree, if you go back one slide, on my profile, Riley County is not listed as one of my preferred course counties. On the next slide again, Bree, the same type of message would show up at the top that says that the course that I selected is not in my preferred course list, my county list. So it's just, again, another heads up. You might still choose to travel across the state because it makes sense for you to do so for that particular offering. But it's another way that we've allowed the system to provide additional information for you so you're more aware of what it is that you're signing up for. Okay, so if you go one more slide. So this is just an example again of I've logged in, I've created a profile. I have my profile. We were looking at that previously, but we also have the option for you to view your order history. So you have the ability now to track what you've purchased in the past for yourself. This is an example of the course that I was just demonstrating. I purchased this course, and I can see a list of all of my orders. If you go one more slide, Bree, there is, when I click into that order, there's all of the details. When I ordered it, the type of payment method that I used, how much it was, and all of the courses that were included in that order. We do ask that you provide a shipping address on your profile in case there are courses or training opportunities that require that we ship materials out to you. So for this particular course, it doesn't require any materials to be shipped. It will still show the shipping address, but I only get shipped materials when it's relevant for the course that I signed up for. Okay, next slide. All right, so back on the profile again, I just wanted to call attention to, right now we're looking at the details view. This is the view where I see all of the details about myself, my individual professional details, my contact information, my demographic details. But you'll also see that there are tabs to the right of details where we have the option to include employment history, technical assistance information, and more. So we'll kind of look through the next couple slides on what those views look like. On this slide, we're looking at affiliations. So affiliations is where you are connected to a facility or an organization, either through employment or volunteer experience. So for this example, I selected Kansas Test Account as my place of employment. I indicated that I started there today, and I am starting as my position as a lead staff or primary provider. When you indicate that when you affiliate with a facility, it's always reported, the verification status is self-reported, and then the facility goes in and says, yep, this person works for me, I verify this, and so it becomes a verified affiliation. So you have the opportunity to track as many affiliations as you want. You can track your entire history, your work history in Kansas if you'd like to do so. On the next slide. We also have the ability for technical assistance tracking. So as you work more with coaches or consultants or mentors, if there are assessments that you complete with their support, so maybe you do a class observation or something like that, that could be tracked here. So you can see results of that information there. Anytime that you have a session with a technical assistance provider, a coach, a mentor, or consultant, they can track the information there, when they did it, how long it was, what the topics were, and then if they have any more intensive plans, so technical assistance plans, those can also be tracked in your profile and accessed by you as well. So many times, you might have previously engaged in some of those opportunities, and gotten that information by paper, or maybe you weren't able to see that at all because it was housed in a system with the people that you worked with that you didn't have access to. But now you really have access to that information when it's recorded here in the system. Okay, and lastly, resources. So if you're working with a technical assistance provider or you receive resources from a course, we also have the option here for that to be recorded on your profile as well. So you'll be able to see a list of all of the things that you've received. Did you get a KELS workbook, a KELS book after completing a Kansas Early Learning Standards class? Things like that can be tracked here as well. So you'll be able to see when you received those and what the resource was. So access to a lot of information at your fingertips there. Okay, so that was a brief sneak peek. I wish I could give you more. We're working really quickly to get all of that information available for you all as soon as we can. But right now, like I said, we're working as fast as we can to get the information for you. We're working to develop resources and information to prepare you to transition to CAPE. On the next slide are just a few of the many topics that we're working on providing some information, creating one-pagers and other types of resources for you to access to answer some of the questions that I'm sure you all have about this new system. I'll just run through them really quickly. This is just a small snippet again of what we're working to prepare for you. But at a minimum, to share with you here, the first question I'm sure some of you are asking, how much is it to join CAPE? And I'm happy to share that there's no cost associated for the workforce to join and use the portal. So it's a free service to you. You can use CAPE to register for professional development, and those things might have an associated cost, but using the portal, getting into the system, getting technical assistance, coaching, all of those things remain free to you. Will there be step-by-step instructions to help you use CAPE? Yep, we are working on FAQs for you, and those things will include how-to documents, videos, screenshots. We're continually building those now, and we'll continue to build those as we launch CAPE and learn more from you all about the questions that you have. To add to a CAPE knowledge-based repository. So we'll have a location for you to go to search those types of questions and find the resources and information. And those things will be available to you at all times. So we'll continue to build out those resources again as we receive help desk requests for information, so that we can make sure that you have the information you need to meet your learning and career needs. CAPE is a secure platform. Your profile is private to you unless you choose to affiliate with a facility or an organization. And at that point, data about you becomes visible to those facilities or organizations. But at any point, you can choose to remove affiliations so that information, again, becomes private to you. CAPE is not a public database for childcare providers. So families won't be accessing CAPE to search for or contact providers. CAPE is really an individual professional platform. And again, facilities and training organizations will access the information too as resources for you, but it will not be, the intention is not for families. The intention is for individual professionals. So if you move from one facility to another, will all of your information still be available in CAPE? And the answer is yes. Each individual professional owns their own CAPE profile. So no matter where your career takes you, you and your profile and all of the related information stays with you. And that's really why we advise when you create your profile in CAPE that you use a personal email address so that you don't lose access to the email address that you've created for your profile if you change employment. And finally, what do you do if something is missing or inaccurate in your profile history? And who can edit your information? So you can edit your email address and other personal information on your profile, including your education, your employment history, when you log in. If you see any information on there that's inaccurate, or concerning to you, you can contact the agency that provided the training to resolve if it is related to training, or if it's about your profile history or affiliation history, you can contact CAPE staff directly and they can help resolve that issue for you. So again, just some brief information for you. We're working to expand that list to provide as much information as possible to you as we continue to prepare for this launch and this transition to CAPE. If you move to the next slide, Bree, just a last resource for you here. As we work to transition CAPE for this launch, you can find information at kcito.org/CAPE that provides some high-level overviews of what to expect in CAPE. We'll be updating on the timeline and anticipated releases. I see Julia put the link directly in chat too, so you can access it there as well. But that will be updated as we continue through this process and this transition.
All right, thank you so much, Haley. Are there any questions or anything that anybody wants to share? You can use the chat or you can come off mute and ask directly. Just wanted to give you that space just in case. But yes, we do apologize for the video. The link to that is in the chat as well. And I can also email that out at the end of the presentation as well. All right. I don't see any questions. So Bree, if you wouldn't mind going to the next slide. Perfect. We will have Melissa Schoenberger, who has joined us today to go over some of the new Child Care Systems Improvement Team initiatives that are happening across the state. So Melissa, without further ado, you can take over for us.
All right, thank you, Julia. I don't know if mine is as exciting as CAPE. We are lockstep in partnership with KCCTO, and so it's just always exciting to hear Haley and team discuss CAPE and what the new landscape will look like in the next year. So that being said, let's talk about some additional initiatives within childcare licensing, specifically with our Child Care Systems Improvement Team. Bree, if you wouldn't mind moving forward. As Julia said, I am Melissa Schoenberger. I'm the Director of our Systems and Field Services within Childcare Licensing. And my contact information is here if you have further questions, and we can also drop it into chat following this afternoon's presentation. Bree, ready for the next slide, please? The Systems Improvement Team is part of the early childhood governance within the state of Kansas. In simple terms, the Systems Improvement Team really is the sounding board for childcare licensing at KDHE. It is multifaceted. It includes state partners, it includes providers, we have licensing specialists, otherwise known as surveyors. We have I think we even have an architect this year, which I'm really excited that we have a voice because we really spend a lot of time focusing on what a child care facility looks like, and having that additional layered lens that we've never had on our systems improvement team brings a voice to the table, a very valuable voice to the table. So when I say it encompasses very a multifaceted approach, I truly mean that. As I said, they are our sounding board. They provide us integral feedback of what we're doing well and what we can improve on. And this last year, we included, they were sounding board for our regulation review. They provided us guidance as we put together a PR campaign, the Child Care Matters, and they helped us draft a toolkit. And this over this next year, in 2024 and 2023, we focused in on two initiatives. It's our small center pilot and our roundtable discussions. So we're going to intimately, over the next few slides, go a little bit more over those two initiatives. Bree, if you want to move forward. So we're going to first talk about our small center pilot. I am really excited about our small center pilot. It is an initiative that really rose up at the provider level. And I am proud to note that Janica Knoll, the provider that was always knocking at my door, challenging KDHE to do better, to look at how we can move a home provider into a commercial setting, but not take on all of the challenges of our full centers. Because our centers, when we think of a child care center, we're looking at possibly a capacity of 60 or more. And Janica did not want to serve 60 children. She really wanted to carry that home provider feel and spirit into a center setting, but still feel like home. And so she continuously stayed in touch with me personally, shared a proposal that she drafted. And at the same time, what she did not realize is that the department, meaning KDHE, was also looking at drafting what we would look at as a small center pilot. And then we converged together, and we really looked at a model, which is still a pilot, that really fit rural Kansas daycare services. We wanted to make sure that we were looking at affordability for owner and parents. That was really Janica's the drive. She wanted to continue what we see so much in our home, our family child care home base, is that mixed age delivery. She wanted to expand an option for home providers. She wanted to really have that ability to move outside of her home and serve more children, but yet make it feel like her home. And then from the licensing perspective, what I needed to do, and really championing with the department, is I needed to listen and learn. Janica had some amazing ideas, and I really needed to just focus and spend some time and learn from her perspective and lens, and not always look at it from a state perspective. And out of that came our small center pilot. Bree, the next slide, please. And I'm hoping this will play, because this is Janica really talking about her vision for the small center. And I see she is frozen. I think we may be having technical difficulties too. Okay, well, and I know Janica is joining us, but in true provider fashion, she is listening while she is also taking care of children. So I'm not going to ask her to come off mute. But I will really say that I love her testimonial, because she never gave up. And it looks like we're also trying never to give up, and see what she has to say. Or if not, I will just keep ad-libbing for Janica.
So I had run a home daycare for probably 5 years before I decided to come up with the pilot idea, I guess. And I was always full. I always had a waiting list, and I was having to turn people away. And there were several parents who couldn't work because they didn't have a place for their child to go. There was others that were taking them to places they didn't feel comfortable taking their kids. And that just broke my heart. I couldn't imagine dropping my kid off somewhere where I didn't feel like they were going to be well taken care of. So I hated turning people away. And I knew that there needed to be something for rural communities because centers were just not feasible with the jump in numbers that we have. Like you could have 6 infants, for whatever 6 months, and then all of a sudden you don't have any, or you could have 5 preschoolers and then you don't have any, and you could have 15. It just varies so much in a small community that we need something that will vary with us. And that's when I started kind of compiling the ideas with my mom. She actually helped me write the pilot plan because I'm not a very good writer. So my mom jumped in and helped me write it, and we came up with a small center.
Okay, what I most appreciate about Jenica's testimonial is the connection with her family and how she never saw a barrier and she kept moving forward. And so we needed to take up this same mantle and look at what licensing may have been perceived as a barrier and how do we move forward and make the small center pilot truly a program type. Bree, if you want to move to the next slide, please. So we took a multi approach. We wanted to look and assess community needs because Janica not only lives in a rural area, she lives in a frontier county, meaning that geographically there are less people. And so that means less resources and less options for families. We wanted to map out our barriers, which included looking at our program director qualifications for a home provider with multiple years of experience and what that would look like moving into a child care center. And we really also wanted to revisit and look at our staff child ratio and what that mixed age delivery would look like and the expectations for supervision and what that one room vision really means. We wanted to look at limitations in our current system. And then we wanted to challenge traditional licensing norms. I knew we were getting somewhere when my staff were saying, "Oh, Melissa, this makes me feel a little uncomfortable." And the only way you really move a project forward and you're doing something well is when you're making people uncomfortable, because that's when you're changing the system. That's when you're changing norms. And then again, all through the way we listen and learn. We had multiple outreaches with community members who had questions. We really were very selective of who we reached out to within our small center pilot group. And we really wanted to learn more about our rural and frontier communities and how this new program type would benefit them. Bree, the next slide, please. I wanted to give you guys a visual because until you are in a small center pilot and you get that home feel, it's really hard to explain. And I really value the attention that Janica put into her space and then the ability to let us share what her space looks like. I'm hoping to put together a virtual tour where she can walk us through and how they use their space, but it really does feel like a home. And then an extended unintended positive is that she also was able to work with her community, and she refurbished an old storefront that used to be actually a boutique in her community. And so not only was she able to double the amount of childcare slots in her town, but she was also able to save just an old storefront that was just otherwise empty. So it was a win-win on the commerce side and on the childcare side on so many ways. And it's really, when you're coming into her community, it's an amazing sight to see. Her childcare is one of the first things that you see when you're coming from that side of town. If you want to move forward, Bree, please. I'm also sharing with you another pilot. And this is ran by a home provider as a program director in this facility. But the ownership actually is from a child care center lens. So the aesthetics look a little bit different, but it still feels, it's still that multi-age setting in one group room to be able to take advantage of all of the exceptions and the updated staff child ratio that we specifically have within our small center pilot. Next slide, please. Oh, okay. So to summarize, before we get into the roundtable discussion, we are still in a pilot. We are hoping in 2025 to really nail down, because we're also an evaluation component on our small center pilot. What worked, what didn't. We didn't want to provide all of these exceptions and then compromise health and safety at the base level. So we are working to do evaluation of staff, families, licensing specialists. Our pilots are also getting additional surveys. So it wasn't just, hey, we're going to do our initial survey and we'll see you in a year. It's okay, we're going to do our initial survey and then we're going to see you multiple times over the next 6 months and if not longer. And so we've really been evaluating and having those additional surveys to better understand. Hopeful that in 2025 we can take all of that evaluation and then really look at how we move this pilot into a permanent part of childcare licensing and really make it stable for our rural communities and build something that is just honestly, when you look at a national level, this is a huge movement, and Kansas is a leader in this. You might hear it termed as micro centers, and we use the small center pilot, but it is really a turn for rural states and better serving families, and hopefully provide some stability to the workforce. So more to come. But also wanted to talk to you about our initiative number 2, which is our roundtable discussions. We wanted to be very vulnerable with communities, and we wanted to have discussions with Kansas childhood professionals, caregivers of young children, and anyone interested in childcare. And we really wanted to come to you in your community and ask some really pointed questions. And some of the questions you'll see on this slide are, what is working well related to childcare in your community? What are the biggest needs? And how can the state better support childcare in your community? We hosted our first roundtable discussion last night. I'm a little tired. I live in Hayes, and I think I got home around 10 o'clock. But we went to Abilene last night, and we went to the child care professionals. We hosted our first roundtable at a child care center in Abilene, and we weren't sure who would show up. And I am beyond ecstatic, still energized from the conversation last night that we had everybody at the table. We had providers, we had folks from a school district, we had some of our partners from KCCTO, from Child Care Aware. The part that I will note that the missing piece is we do need more consumers of our products. So meaning we need more parents, foster parents, whoever is consuming the child care service. We need to get better at bringing them to the table. But last night was definitely a first start. And some of the comments that I wanted to share with you that we heard is what is working well. And support from child care licensing really heard echoed the appreciation of us coming to them, to your communities, versus the expectation that we all need to travel into Topeka, and that's me included, to have conversations. That, you know, KDHE and specifically child care licensing, when we want to engage community members, we're always going to come to you. We're the expectation is we don't expect you to come to us, but we really want to dig in and understand better the work at the community level. So we will always come to you. Some of the biggest need that we heard last night that I don't think, especially for this audience, would be something new is a living wage, addressing workforce challenges such as insurance. And so very, very big conversations that not necessarily align with child care licensing, but is an agency, a state agency, that's a part of the early childhood landscape. We will continue to echo your sentiments and make sure that we continue to get your voice heard. And then something that was more than once of how can we better support you? And that's at the state level. Loved that there was a lot of conversation around more mentoring opportunities. I think I heard more than once last night, and we spend a lot of our day with little people. And we really need that adult support. And what can the state do more to get more of those mentoring opportunities? So again, not necessarily something that aligns with licensing, but as a part of the systems, the work that we do with our partners, that'll definitely be something that we will share immediately, because the mentoring opportunities, I was looking at our sticky notes this morning, mentioned in multiple areas, like through better support and our biggest need. So something that the workforce is needing and wanting is that structured support, and not from an outside agency, but from peer to peer. And so what can we do better to foster that will definitely be something we will put forward. Bree, if you want to move to the next slide, please. So again, as I mentioned, our first roundtable was last night, and then we are looking at a January roundtable. And I think when I put this slide together a couple days ago or provided information, we hadn't solidified and locked down our dates. But barring any weather, because we do live in Kansas, we are looking at January 29th in the South Central area, specifically in Wichita. So look forward to some a flyer, some type of communication, either from KDHE, all in from Kansas, and then we will get you time and location as we get closer to January 29th. And it should be a really great day because January 29th, a little trivia, is Kansas Day. So bringing folks together to talk about child care licensing on Kansas Day, I think is a powerful shift, and looking forward to the ongoing conversation. If anybody has any questions, I know we started a few minutes late. Feel free to email me, drop them in chat, and we will make sure that we get all of your questions answered. And thank you for having the systems improvement team here today.
Thank you so much, Melissa. If you pass that information along to me about that January roundtable, we can also shout that out at the December webinar as well. So that's a place that we can promote that. Bree, if you want to go to the next slide, I just have a couple of early childhood systems updates for y'all before we let you go. One more slide, Bree. All right, the Kansas Early Childhood Care and Education Workforce Study are holding a Your Voice Counts webinar. You can join the survey results webinar to discuss data-driven supports that break down credentialing and education barriers in early childhood care and education, turning workforce study insights into your pathway to success. So you can join KCCTO next week on Thursday, November 19th to engage live with the workforce study results and learn how this data will impact further supports and development of the early childhood care and education workforce in Kansas. They have two different meeting options on Thursday, November 19th, one from 1 to 1:45 in the afternoon, and an evening session from 7 to 7:45 at night. And both of those registration options I just put in the chat for you. There were 5,623 workforce study surveys completed, 39 focus groups held, and they had 100% representation from each county in Kansas. So that means that each county was represented in that survey. Bree, you can go to the next slide. All right, next from KDHE, they are offering a fingerprinting services training for child care providers. This is a free training that they are offering on how to fingerprint for your child care staff to better assist child care providers with accessibility to obtain fingerprints. The KDHE Child Care Licensing Team is holding an event where you can have the opportunity to be trained to conduct fingerprinting. So this is a free 2-hour training for any childcare centers or homes that is happening this Saturday, November 16th from 10 a.m. to noon. And that is being held at the Garnett Public Library at 125 West 4th Avenue in Garnett, Texas. So that is another great thing that KDHE are offering to try to make fingerprinting more easily and accessible for all of the childcare providers out there in Kansas. I just went ahead and dropped that link in the chat as well to register for that training, and we can move on to the next slide. All right, Thriving Children Research Series. Learn about new research impacting the field of early childhood education and development during the Thriving Children Research Series, which is a webinar series being hosted by the United Methodist Health Ministry Fund and its partners. On November 14th, so tomorrow from 1 to 2, they'll be discussing leveraging the CCBHC model to enhance childhood mental health. And a little more on the CCBHC. The years from birth to age 5, as we all know, are critical for a child's development, with rapid brain growth and increased neural connections, laying the groundwork for cognitive, emotional, and social skills that last well into adulthood. In Kansas, there has been progress in recognizing the importance of infant and early childhood mental health and expanding that access to services for young children and their families. However, challenges still remain. So the Certified Community Behavioral Health Clinic, the CCBHC, presents a framework to address these gaps, emphasizing comprehensive, person-centered care through strategic partnerships, workforce development, and targeted interventions. So that webinar will be held tomorrow from 1 to 2. And then on November 19th from 1 to 2, ABC Parent Coaching Program Promising Insights will be the webinar topic for that day. So social emotional development in young children is also a critical factor related to later life outcomes, such as school success, social interactions, and mental health. A growing body of research demonstrates that investing in science-based, short-term early interventions pays off over both the short and long term, delivering lasting results that not only change lives for the better, but also produce substantial returns on that investment. So the ABC program is the Attachment and Biobehavioral Catch-Up Program, which is an evidence-based home visiting intervention for caregivers of infants and toddlers who have experienced early adversity. It is designed to buffer the harmful effects of toxic stress and help support normal early child development. So both of those webinars are some free options, and I am going to put that link in the chat for you to learn more and register for those. Bree, you can go ahead to the next slide. So just quickly, our reminders and next steps. Our next early childhood recommendations panel is being held this Friday, November 15th from 9 a.m. to 11:30 a.m. That meeting is always live streamed on the Children's Cabinet YouTube channel, and it will live there as well after the fact, so you can always go back and watch the recording. Our next Children's Cabinet meeting will be held on Friday, December 6th from 9 a.m. to noon. And then our next Early Childhood Systems Building webinar will be on the second Wednesday of December, which will be December 11th from noon to 1. Again, you can find all of these meetings and more on the Children's Cabinet YouTube channel. And then next slide, you can stay up to date with us by signing up for that All In for Kansas Kids e-newsletter. You can follow us on Twitter, now known as X, and you can subscribe to the Children's Cabinet YouTube channel as well. So dropping all of those links into the chat for you now. And thank you to everyone who joined us. Thank you to Haley and Emily and Melissa for presenting today. And again, sorry about some of those technical difficulties. I will be sending out the CAPE portal video in an email to everyone in just a moment after we close out this webinar. So thank you again for joining us, and we will see you next month.